This is Erik Dalton, and I'd like to give you a sneak peek into a few of the gems in my Technique Treasures e-learning course. I begin with a 30-minute stress-busting routine that takes you through relaxation techniques for the entire body. In upper cross controversy, we assess and treat clients presenting with forward head postures caused by a brain-body disconnect. In occipital neuralgia headaches, Paul Kelly and I treat a client with suboccipital spasm and a head rotation problem. As we all know, breathing is our most dysfunctional movement pattern. In this article, I show how to treat respiratory and pelvic diaphragm problems. When treating neck cricks, I always begin with a cervical decompression technique similar to this, and then I address alignment and protective muscle guarding problems. I love this technique because you can really get a fascial drag by using your forearm, pronating and supinating your complete arm. Pelvic floor dysfunction is a common problem, particularly in women, and I love this technique for stimulating tone in weak levator ani muscles. When aligning the hip and knee, I typically begin with an old Ida Rolf technique called the log roll. Terry has an externally rotated femur, so I'm bringing the tissue into internal rotation to take pressure off the knee. Now, this SI joint technique is great for your clients suffering hip and leg pain due to pelvic alignment problems. In the clicking jaw syndrome article and video, I show some simple TMJ techniques for relieving pain and protective spasm. Here I'm working on our masseter muscle with my finger on one side and my thumb on the other. Carpal Tunnel Revisited discusses alternate approaches for relieving hand pain caused by inflamed flexor muscle tendons crowding out the median nerve. In rotator cuff tendinopathy, the goal is to try and drop the humeral head down into the bottom part of the glenoid fossa to relieve rotator cuff tendon pain. Notice how I use a webbing technique with my left hand while I internally and externally rotate Terry's arm. This helps drop it down into the bottom part of the glenoid fossa. This is one of my favorite techniques for addressing iliosacral alignment problems that can sometimes cause sciatica. Keith has an anteriorly inferiorly rotated left ilium, so I'm pulling on that ilium and compressing with my right hand on the ASIS. Learning how to treat femoral nerve pain helps you differentiate quadriceps strain from femoral nerve pain. In Scoliosis Fixed or Fixable, Paul Kelly and I assess and treat a client with a structural scoliosis. This article helps explain how to deal with different kinds of scoliotic patterns. Now, this is an illustration of Bryce's right thoracic scoliosis. And so we want to take the scapula and bring it back up onto the rib cage where it belongs. The Between the Blade Pain article and video teaches you how to identify T-spine and rib pain caused by reactive muscle spasm. In the hiatal hernia and GERD article and video, I discuss ways to help relieve diaphragm spasm that can cause digestive problems and possibly a hiatal hernia. In the Treating Rib Pain article and video, I teach you how to mobilize a stiff and painful rib cage. Now, Addressing Meniscus Tears is a great article that shows how to identify common knee complaints in your athletes and computer addicts. Now here I'm using the medial lateral grind test for pain provocation just by palpating the meniscus and internally, externally rotating. And to wrap it up, this is my favorite way to treat piriformis syndrome because you can actually contact the insertion of piriformis here at the greater trochanter. Notice how I have a counterforce going here where my left hand is bracing at Terry's thorax while my right forearm drags piriformis distally. I hope you enjoyed this flyby of my new Technique Treasures e-learning course. Thanks for watching.